Listen, I want you to really listen to what I'm about to tell you. Because if you're over 60 and you've noticed your hearing isn't what it used to be, the information in this video could literally change the trajectory of your life. And most doctors will never connect the dots for you. They should, but they won't. I've been practicing medicine for over 25 years. And I can tell you with absolute certainty that one of the most dangerous blind spots in modern medicine is the failure to address hearing loss as a cognitive health crisis. We catch cancer early. We monitor blood pressure obsessively. We check cholesterol. But hearing? Hearing loss gets shrugged off as just another sign of aging. A minor inconvenience. Something you get used to. And that dismissal is destroying people's brains. My name is Dr. David Miller, and I've spent years studying the connection between sensory decline and cognitive function. What I've discovered, what the research absolutely proves, is that hearing loss is not just about your ears. It's about your brain. It's about your memory. And if left untreated, it's a direct pathway to dementia. I need you to pay attention right now. Because if you're experiencing any of these things, struggling to understand conversations in noisy places, asking people to repeat themselves more often, avoiding social gatherings because they feel exhausting, noticing you're turning up the television more and more, you need to hear what I'm about to explain. Here's what the research tells us, and this is important. A meta-analysis published in 2024, combining data from 50 different studies covering more than 1.5 million participants, concluded something remarkable. For every 10 decibel worsening of hearing, your dementia risk increases by 16%. Not 2%, not 5%, 16%. Let me put that in perspective. The 2024 Lancet Commission on Dementia, the world's leading authority on preventing cognitive decline, identified hearing loss as the single largest modifiable risk factor for dementia in midlife. Not high blood pressure, not cholesterol, not weight, hearing loss. They stated directly that addressing hearing loss could prevent approximately 1 out of every 14 dementia cases globally. That's millions of people every year who could maintain their cognition simply by treating their hearing. Now I want to explain exactly what's happening in your brain when you have untreated hearing loss. And this is where most people have it completely wrong. They think hearing loss is isolated to the ears. It's not. The damage is happening in the brain. When you have hearing loss, your ears are not sending clear signals to your brain. Your auditory nerve is transmitting degraded, incomplete information. Your brain receives a garbled version of what's actually happening in the world around you. And your brain responds the only way it can. It works incredibly hard to fill in the gaps and make sense of incomplete data. Think about what this means. Every conversation becomes cognitively exhausting. You're not just passively listening. You're struggling. You're guessing at words you can't hear clearly. You're relying on context to fill in blanks. You're essentially working overtime just to understand normal speech. And this happens day after day, week after week, month after month. Neuroimaging studies have shown us something remarkable. People with hearing loss show accelerated shrinkage in multiple brain regions. The temporal cortex, the area responsible for processing sound and language. The hippocampus, the critical memory center. The prefrontal cortex, essential for executive function and decision-making. These are the same regions that shrink in Alzheimer's disease. In fact, research from multiple imaging studies demonstrates that people with moderate to severe hearing loss have significantly smaller hippocampal volume than people with normal hearing. The hippocampus is the part of your brain where memories are formed. When it shrinks, memory formation itself is compromised. This isn't theoretical. This is measurable, visible brain damage. But that's just the first mechanism. Because there's something else happening that's equally destructive. When you have untreated hearing loss, you withdraw from social situations. And I mean that quite literally. When conversations become difficult and exhausting, people stop going to dinner parties. They stop attending social events. They stop going to church, to clubs, to gatherings where there's background noise. They isolate themselves. And here's what people don't understand about social isolation. It's not just sad. It's not just lonely. It's a direct assault on your cognitive function. Studies have shown that socially isolated individuals have a 50% increased risk of developing dementia. 50%. Loneliness is as damaging to your brain as smoking. It's that serious. So you have a perfect storm developing. On one hand, hearing loss forces your brain to work excessively hard just to process sound. This depletes your cognitive reserve, your brain's capacity to adapt and compensate for damage. On the other hand, hearing loss drives social isolation, which removes the mental stimulation and engagement your brain desperately needs. These two mechanisms work together, and the result is accelerated cognitive decline. I had a patient named Margaret. She was 74 when she first came to see me. Margaret's family was concerned because they'd noticed changes in her. She was forgetting things. She wasn't as sharp as she used to be. She was quieter, less engaged. Her family was worried about early dementia. But when I examined Margaret, the first thing I noticed was that she had significant hearing loss. She'd always been someone who loved being around people, loved socializing. But over the previous 3 years, social gatherings had become stressful. She couldn't follow conversations. The noise was overwhelming. So she'd started making excuses not to go out. She spent more and more time alone. Her family didn't connect the dots. They saw cognitive decline. They thought dementia was coming. They didn't realize the actual problem was her hearing. I fit Margaret with hearing aids. She wore them consistently. And here's what happened over the next 6 months. She started going out again. She reconnected with her friends. She started attending her book club, which she'd quit 2 years earlier. Her husband told me that her memory improved noticeably. Her engagement came back. She was her old self again. Margaret is not an isolated case. The Achieve study, funded by the National Institute on Aging, followed 977 older adults aged 70 to 84 who had untreated hearing loss. They randomly assigned some to receive hearing aids and cognitive training. Others received a health education control intervention. The results were definitive. People who treated their hearing loss with hearing aids showed 48% slowing of cognitive decline over 3 years compared to the control group. 48%. Let me be clear about what that means. That's the difference between your memory staying relatively stable and experiencing measurable, noticeable decline over 3 years. That's the difference between living independently and potentially needing help. And here's something else that's crucial to understand. The earlier you treat hearing loss, the better the outcomes. A French study called the Packwood study followed people over 25 years. They found that people who adopted hearing aids within 3 years of being diagnosed with hearing loss had significantly better cognitive protection than those who waited longer. The window of opportunity matters. Most people with hearing loss wait an average of 10 years before seeking treatment. 10 years. Imagine the cognitive damage that accumulates over a decade of unaddressed hearing loss. The brain shrinkage, the social isolation, the depleted cognitive reserve. By the time someone finally gets hearing aids, significant damage may have already occurred. Let me tell you the warning signs you should watch for. The most obvious is difficulty understanding conversations, especially in noisy environments. Restaurants, crowded rooms, family gatherings, these become exhausting. You find yourself asking people to repeat themselves frequently. Another sign is that you stop participating in activities you used to enjoy. Not because you don't want to go, but because the social demands feel overwhelming. Some people notice they're turning up the television higher and higher. Others struggle during phone conversations or miss important information at doctor's appointments. Some experience tinnitus, a ringing or buzzing in the ears. While tinnitus doesn't always accompany hearing loss, it's often a sign that something's wrong with your auditory system. And here's something doctors often miss. People with hearing loss sometimes complain of dizziness or balance problems. The inner ear contains both hearing organs and balance organs. If one is damaged, the other often is too. The critical thing to understand is that hearing loss typically develops gradually. You didn't wake up one day unable to hear. It happened incrementally over years. So the first sign usually isn't that you can't hear. It's that you're struggling to understand, particularly in difficult listening situations. Now, why does this happen? What actually causes hearing loss? The inner ear contains thousands of tiny hair cells. These hair cells vibrate in response to sound waves and create electrical signals that travel to your brain as sound. When those hair cells are damaged, they can't vibrate properly. The signal to your brain becomes weak and distorted. Several things damage these hair cells. Aging is one. The hair cells naturally deteriorate over time. Exposure to loud noise is another, which is why people who worked in loud environments often have hearing loss. Certain medications are ototoxic, meaning they damage hearing. Some antibiotics and cancer medications are particularly damaging. Diseases like diabetes and high blood pressure damage the small blood vessels supplying the inner ear. Head injuries can harm the hearing structures. The problem is that once hair cells are damaged, they don't regenerate. The damage is usually permanent. This is why early detection and treatment are absolutely critical. But here's what gives me hope. Even if you already have hearing loss, treating it can make a profound difference. Hearing aids don't restore damaged hair cells. What they do is amplify sound so it's loud enough to be processed by your remaining functioning hair cells. But more importantly than that, they restore your ability to engage with the world. They reduce the cognitive strain of struggling to understand. And they pull you out of social isolation. And the evidence is clear. People who wear hearing aids maintain better cognitive function than people with hearing loss who don't wear them. Faster reaction times, better memory performance, lower rates of cognitive decline. So what should you actually do? First, if you're over 60, you need to have your hearing tested. Not because you think you have a problem, but as a screening test. Just like you get your blood pressure checked and your cholesterol monitored, your hearing needs evaluation. An audiologist can perform a comprehensive test that tells you exactly how well your ears are functioning across different sound frequencies. Don't wait for problems to become obvious. Mild hearing loss is often not apparent to the person experiencing it. It's much easier to address when you catch it early. If you're found to have hearing loss, the second step is to discuss treatment options with an audiologist. There are different types of hearing aids available. Over-the-counter hearing aids are inexpensive and work reasonably well for mild hearing loss. For moderate to severe hearing loss, working with an audiologist who can customize devices to your specific hearing profile is better. There's typically an adjustment period when you first start wearing hearing aids. Your brain has gotten used to not hearing certain sounds. When you suddenly hear them again, it feels strange. But your brain adapts remarkably quickly. Within a few weeks, most people adjust and wonder how they ever managed without them. The second thing you need to do is prioritize your overall cognitive health. Hearing loss increases dementia risk, but it's not the only risk factor. You can reduce your total risk by maintaining regular physical activity, eating a diet rich in omega-3 fatty acids and antioxidants, staying mentally active through reading and learning new things, and maintaining strong social connections. Stay engaged. Stay in conversation. Stay involved with other people. These things matter profoundly for your brain's health. If you've been avoiding social situations because of hearing loss, I want you to know it's not too late. Getting help for your hearing can pull you out of that isolation. Research suggests that doing so can slow cognitive decline significantly. Let me summarize the key points because this matters. Nearly 2/3 of people over 70 have hearing loss. Untreated hearing loss is linked to dementia risk that's 2 to 5 times higher depending on severity. The mechanism is twofold. Hearing loss forces your brain to work excessively hard, which depletes cognitive reserve, and it causes social isolation, which accelerates decline. Treating hearing loss with hearing aids can slow cognitive decline by nearly 50%. And the earlier you detect and treat hearing loss, the better your outcomes. You have more control over this than you might think. Unlike dementia itself, hearing loss is treatable. Hearing aids are available. They're effective, and the research is absolutely clear. Treating your hearing is one of the most powerful things you can do to protect your cognitive future. If this information resonates with you, if you've noticed changes in your hearing, I want you to take action this week. Schedule a hearing test. It takes less than an hour. It's completely painless, and it could literally change the course of your life. And if you know someone who's struggling with hearing loss, who's been avoiding social situations, share this video with them. They may not realize how critical this is. They may think they're just getting older. But hearing loss and dementia are connected, and treatment works. Subscribe to this channel because every week I share research-based health information specifically for adults over 60. In my next video, I'm going to reveal the one dangerous habit millions of people have every single morning that's directly accelerating brain aging. And I'm going to show you exactly how to stop it. I'll see you there. This video is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare provider or audiologist before making any changes to your hearing care or treatment plan. If you experience sudden hearing loss, seek immediate medical attention. Hearing loss can be caused by various medical conditions, some of which require professional evaluation. Your individual hearing needs, medical history, and health status should be evaluated by a qualified audiologist or healthcare provider.